Hey everyone, it's Sue here, and I just want to go over your simulation requirements. And if you remember, we have 3 simulations in this course, one in each of the sort of 4-week sections. So this is simulation 1 that's going to round out our first section of the course, the first 4 weeks. And the focus here is going to be fluid and electrolytes. So we'll see if you think it sort of ties together some of the thinking and learning that we've gone through in the course. So let me just go over it for you here. The requirements for sim, do you remember we talked about simulation is only effective when we follow an evidence-based approach. And this is the evidence-based approach. There are these requirements. There is a self pre-assessment. It's important that we do that self-assessment before we do our simulation. It just takes the learning objectives for the sim. It asks you to circle whether you feel competent, or not competent, not confident, and write a sentence or two in each of the categories associated with the learning objectives. There's a Dropbox for that self pre-assessment. So you're going to complete that before you do the sim. It should take like 5 minutes, not even, and you're going to submit that to your Dropbox, right? And just a sentence or two for each of those learning objectives. Then you do the prep. So it's always necessary to do some preparation for the sim. Now for this course, we've really tied this prep to what we've been doing in the last 3 weeks and this week. So it's going to be a fluid and electrolyte focus. And throughout those weeks, we've done focused on fluid and electrolyte. So you can go back and look at that. There's a pre-brief, and in the pre-brief, you listen to a recorded pre-brief because we're doing a virtual sim. If we were doing this in a lab setting, we would speak to you immediately before the sim, introduce you to the learning objectives, what is the focus. If we were doing something where you'd have to use equipment, we would show you where the equipment is. And so there will be a Zoom link for a short recorded pre-brief, and you'll find that in the module, which is like the folder that has all the simulation 1 materials. And then you conduct the simulation. So you've done the pre-assessment and you've loaded it up into the Dropbox. You've done your prep, reviewed your materials. You've listened to the pre-brief, and now you click on this link here to do the simulation. And this is a virtual game, and it focuses again on fluid and electrolytes. Now, what I would say is virtual games have benefits, and some people really like them. I think one of the real benefits you find is there's those decision points where you get to make a decision based on what's happening in the situation. And if it's correct, they give you the rationale for it being why it's correct. If it's not correct, you get to go back. They give you the rationale for why it's not correct, and you get to go back and then consider what is the best choice. I would say just my own thinking, because this is our first sim, we're all at different points. I just think this is not a fast-paced sim, right? So it's not a fast-paced sim. We'll move a little bit further into even higher acuity sims with the next 2, but for this one, it's an evolving sim. It is a patient who has a very concerning medical status, but it is not a fast-paced sim. So I just want to warn you so you don't become disappointed. It's a very valuable learning sim that's not fast-paced. Following the simulation, we do a debrief. Now, again, if we were doing a simulation face-to-face in the lab, then we would go after the simulation, we'd all meet up, we'd talk about your experience in the sim, we'd focus on those learning moments, the learning objectives, and we'd have kind of a focused debrief, right? So we would be prepared with some questions and cues, but also we follow up on the students and where they go. In this case, what you're going to do is actually within your small groups, remember you've all been assigned to small groups, so you click on your group, you go to the discussion forum, and there'll be a forum set up for you there that says simulation 1 debrief, and then all of you in there answer the questions. I'm going to go over those. They're on the next slide, these debrief questions, and you're going to discuss with each other. So talk about if you're struggling. So imagine like you're a team. Just think of yourselves as a team trying to figure this out. It's not that you're trying to answer it perfectly for me. You're working together to come to an understanding of what is the best answer, where would you find information, things like that. So I would say make sure that you work with your team, that you have enough time. So it's due by the end of the day on Sunday, February 7th, that you've done that, completed that debrief. But if you want to have some discussion, some opportunity to discuss, the sooner you can load it or start the discussion, the better. It doesn't have to be formal. You don't have to wait till everything is done. You could look at it and say, oh, I'm on question one, and I'm not really sure where this is going. What do you guys think? So my goal is not to say I want everything perfect. My goal is for you to use your resources together, because that's going to mirror practice, right? So where do I find that information? How did you see this unfolding, or what would you see as the next step? And you're working together. It's not about a pure fabricated correct answer. It's about discussing those questions, right? And they're often nuanced. So you're going to see those discussion questions. And then also I'm going to ask each of you to do an isbar report. So most of you have heard of SBAR, situation, background, assessment, recommendation. This is a process that we use that really is helpful for providing a concise reporting of a situation in a predictable fashion, so that we can communicate interprofessionally in a very concrete way that enables us to move forward with achieving the best outcomes for our patients. It really makes a difference, we know, in nursing care, because one of the things it takes us to is not just describing what I'm seeing with my patient, but what is my recommendation? And that our part really reminds us that it's not just, oh, I see a change in my patient. What is the recommendation? So based on my assessment finding, what is the recommendation? Is it that the patient needs to be seen and assessed? Is it that I think we need to put the patient on a monitor, do a 12-lead ECG, draw some cardiac enzymes? What is it that, depending on the situation, what is my recommendation? And that's really important. Additionally, most of the time we have talked about SBAR. Now we're moving to ISBAR, and all the I stands for is introduction. Because don't forget the beginning part. Hi, my name is Sue. I'm calling from the emergency department. I've got your patient here, Mr. Jones, who blah, 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 right? So the introduction part. So we'll talk about that, because I've got just a little template for you. So it's, remember those debrief questions, you're going to discuss them. And then each of you take a hand at doing that ISBAR report. It's really important, right? It's really important that you do this effectively. This is one of the most valuable tools you're going to have as a nurse in communicating intra-professionally, so with your other nurse colleagues, and inter-professionally. And you're going to discuss all that. Look at how you wrote something, how someone else wrote something, the commonalities, the differences. You're going to discuss that within your small group. That's all I'm looking for. And then your self-assessment. So remember, you did that self-assessment prior to the sim, so self-pre-assessment, same document, but it's going to be post now. You've done all these activities. You've got that blank form again with those same learning objectives. And now you're going to consider, again, across those learning objectives, how confident do you feel? Circle the categories. It might be the same. You might feel more confident. You might feel less confident or competent, because now you think, oh, I thought I knew about this. Now I realize how many questions I have. So it's just for your own learning purposes. You're going to look at that again. You're going to circle the category that fits you for each of those learning objectives, and just write a sentence or two. Again, that's brief. So it seems like it's a lot of things, these 6 different categories. But the reason we make you do that, even though you're submitting all these little elements, is because this is the evidence-based approach. Self-pre-assessment, preparation, pre-brief, simulation, debrief, self-post assessment. And then often in the debrief, we may move on to some kind of activity, an analytical activity, to take that thinking even further. Okay, does that make sense? So you've got the link to the sim here, and you've got, you're going to have the link to the recorded pre-brief in that module, or like where all the folder where you're going to find all the files about sim 1. Here are your small group debrief questions, and I hope you find them kind of interesting. They're not just all medical questions, because they really are about practice, right? Practice. So you'll see in this simulation that a patient has advanced directives, including a do not resuscitate order. And here's a question for you. So some of you may be very comfortable with this, but thinking about your own practice and the requirements for care, what interventions should you take directly related to that DNR order? What do you need to do with that DNR order? The second question is, patients becoming increasingly confused and agitated, trying to pull out their IV and climb out of bed. When should restraints be considered? That's a really important question. Again, we've talked about that in different courses throughout the program. Here you've got a medically unstable patient. What's the solution here? What's guiding your thinking in that situation? Third debrief question, the patient suddenly deteriorates and the patient's elderly partner is demanding to come in and stay at her bedside. The partner is also elderly. She has a chronic respiratory condition and she's at high risk for COVID-19 herself. How would you handle that situation? What do you do? This is a really important situation when we're looking at high acuity. So now we're in the midst of COVID. I know all of you have had different exposures work situations or understand what the hospital situations are like now. And I think I told most of you that my mom was recently in the hospital. We were not allowed any visitors at all for just a couple days shy of a month. And for much of that time, she was in delirium and not able to talk. So there was no communication at all. And we would go many, many hours, a 12-hour shift without even being able to get anyone to answer the phone at the nursing station in the hospital. So understanding how you handle a situation when someone is asking to come in, but that person is at very high risk and they're also policy. How do you work with that? There's policies, right? COVID-19 visiting policies, but do we ever waive those policies? What are the how do you work your way through it? That's going to be a good discussion. Finally, the patient has a change in cognitive status. How should the nurse best differentiate between delirium, dementia, and depression, right? Delirium, dementia, depression. So critical that we understand the difference, right? So they are so acutely different, but with overlapping symptomology sometimes. So how would you differentiate those? And then we're going to ask you to, I'm asking you to do that isbar reporting exercise. So you've got those 4 questions that you're going to answer and discuss amongst each other. Remember, there's not one perfect answer. You're not going to open a page 56 of some book and find the perfect answer, but you're going to discuss it, right? And find some good discussion. And now we're coming back to a sort of a more clinical activity here. You would come back from break in the scenario. We're picking up from the scenario and we're adding a little bit to it. To this end, come back from break, you reassess your patient, and here's what you find. You've got a set of vital signs. The patient is groggy and you're only able to rouse her enough to open her eyes by calling her name and shaking her shoulder, but she immediately closes her eyes and doesn't respond verbally at all. When you do a respiratory assessment, you determine that she's got rapid shallow respirations, nasal flaring, circumaural cyanosis, faint breath sounds in all lung fields, and coarse crackles in her bases bilaterally. You'd like to report your findings and seek further treatment directions from our primary care provider, of course. And so you want to complete an isbar report for this purpose. So here's where I want you to really practice this. I know some of you have had more practice and some of you less. And if you remember isbar, introduction. What's the situation? What's the background? What's your assessment? And what's your recommendation? And on this next slide, I'm going to give you can find all kinds of different templates. And I know some of you have been taught this in a variety of courses, but I'm just going to remind you, and this is a nice template because it gives you some examples. So the I, it could be introduction, or this says identify yourself. So who are you? Where are you working? Basics of the patient, name, age, gender, department. That's not, written in stone. This is an example of a really effective one. S is the situation. So what's the problem, or what's the reason that you're calling the primary care provider? I'm calling because, describe the situation. I have observed major changes in blah, 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 blah. I have measured the following values. So you could talk about respiratory rate, O2 sat, pulse, heart rhythm, blood pressure, capillary refill time. So you're giving information, right? The data and the information. All right, got test results back. And I'm just going to carry on for one more minute here. The background, if it's urgent or if you're... Okay, all right, hold on, guys. Hey guys, I am going to try to wrap this up and I really apologize. And I also know you understand and many of you are living a parallel process. So hats off to all of you in all of your lives. Background, we're looking at if it's urgent or what are you concerned about? You really need to speak up here, right? We need to be brief. We need to give a case history, but you need to be concise, but it's important that you include relevant information. So for sure, when they were admitted and what they were admitted with, if they have a medical history, so past diagnoses, relevant illnesses, if they had a cholecystectomy 20 years ago, and this has nothing to do with that, we're not talking about that, right? They had their tonsils out when they were 5. We're not talking about that unless it's a, 5.5-year-old with some nasopharyngeal problem. But we're talking about absolutely relevant, important information. We're looking at what kinds of treatments or interventions have been in place to date, always mentioning allergies, your assessment. And this is where you're really making an assessment of the situation in the context of the background. So I think that the problem or the reason for the patient's condition is related to this. So it's related to their respiratory status, circulation, their neurological status, I don't know what the problem is, but the patient's condition has deteriorated. That is a fantastic assessment. You think like, oh, I can't say I don't know. You don't always know. This is a mystery. I don't really know what's happening, but the patient's condition is deteriorating. That's okay. Because in the end, this is not about your pride or your ego. It's about getting help. You've done your assessment. That doesn't mean you don't have to assess your patient. You've done your assessment. You don't know what's wrong, but the patient's condition is deteriorating. That's how you report that. Patient's unstable, we need to do something, or I am concerned. That language is really important. That language is critical. Recommendation, suggest, what are you going to recommend? Blood work, fluid intervention, immediate, that patient needs to be assessed by a primary care provider immediately within a certain period of time, blah, blah, blah. Within the context of what is possible. And if you're not sure what it is, you're not sure what needs to be done, then the patient needs to be assessed, right? And you really want to sort of nail that down. So for example, if you're saying, I'm suggesting that a patient needs a cardiogram and some labs drawn and some oxygen administered, then once you get that ordered, the question is, at what point do I call you back, right? So patient had some chest pain. By protocol, I've put on O2 2 liters. I'd like to make sure we do a cardiogram and cardiac markers. And I'll call you back when I get those results, right? So you've got that clarity. I will call you back when I get those results. This is what's happening to the patient, and the patient needs to be seen immediately. Or the patient needs to be assessed. How soon will you be here? And that how soon will you be here really nails everyone down for time. Not like this patient should be assessed and the doctor says, okay, and you think he's coming, but really he thinks I'm going to come tomorrow morning. That when will you be here is really helpful. And then really closing that loop for communication. Make sure, just to sum up, this is what's happening. This is what what's been ordered. This is when we're going to communicate again, or this is when you're going to be here, so that everybody knows everything and you are making sure that you have that well documented. So I hope that's helpful. You can find lots of other templates, but this one is, I think, helpful because it's quite down to earth in letting you know what's there. Okay, this is the first of the sims. I hope you find it helpful. We'll give it a trial. Remember I said it's not a fast moving sim, but it has a little meat to the bone. So I think there is some real value and we get to learn as we go through the process. And I think we also get to pull everybody together. It also brings us all together around fluid and electrolytes and looking at how all those components of simulation and then also looking at isbar reporting. Okay, I hope you enjoy and I will continue to keep up with you guys.